Good morning, I'm Stephanie García van Gol. I'm director of BBVA Microfinance Foundation, where I measure the impact of our group. We hold 5 microfinance institutions in Latin America and 5 countries, and we serve over 3 million clients.
Hello, my name is Braulio Pareja. I'm the head of academic research in Impact Bridge Asset Management, which is an impact investment fund located in Madrid with more than 200 euros under management.
We are here today to discuss financial health in vulnerable communities in a changing financial industry. And to set the tone, I'd like to give a bit more background of what we understand by financial health. Of course, financial health is the backbone of progress for vulnerable households. And we understand it in 3 levels. The first level is how households are able to manage income and expenses, so the day-to-day management of the household. The second part is how they cope with contingencies, with unexpected events. And the third part would be how you're able to manage and plan your finances over time to build assets in the longer term, so investments and savings. Now, if we put that information and that standard to our clients, and our clients are relatively vulnerable, you'll see that in terms of income, for example, 44% of our clients only have their income during 9 months of the entire year. So a lot of our clients are not able to have a monthly income for the entire year. Secondly, in terms of shocks, they face a number of shocks. They range across types of shocks and geography in terms of intensity and frequency, but mainly health, unexpected events in health, but also in business like inflation, for example, are the most relevant for our clients. And I'd say a third, roughly, are unable to cope with those shocks. And then when you look in the long term, they do have that intention to anticipate those shocks. So 80% have the intention to save and therefore find those emergency funds to be able to cope with these contingencies. But in practice, when you ask them the balance that they have, only 22% of our clients are able to survive 6 months with the saving balances that they have. So it's relatively small. So even though the intention is there and they are very good at managing day-to-day expenses, I think that the issue is that they start investing in assets to cope with those contingencies.
Thank you, Stephanie, for this interesting perspective. As impact investors, what we see in our industry is that we need several standards to understand perfectly what is or what financial health is, because we need first to understand in the same way what this concept means, that for example vulnerability, well-being, and secondly we need in our industry the same or using the same standards, tools to measure the impact of financial health. And third, it's very interesting for us to understand how to measure, especially in the financial health, the risk, and how to adapt the financial product to our clients.
Well, I think that's the reason we're here, right? Not just to define financial health, but actually to think how we can address that with the tools and services that we have to improve financial health. And we've been discussing how we're doing in that regard. And I wanted to share sort of 2 angles of that. First, in terms of insurance. It's funny to see, like, we do have a range of insurance products that serve different needs. For example, we have in one country like Peru, we'd have a typical agro insurance to cover in issues or contingencies with climate and the likes, but also a multi-risk insurance. And if you look at the uptake of those 2 products, you'll see that multi-insurance has a significantly higher demand compared to the other product, not only in general, but also over time. It's a product that's doing really well. However, when you think about how they execute the insurance, then we're probably not that effective. Probably they don't know how to use the product, they're not that well informed, they're not that comfortable in understanding. I have issues understanding an insurance product, I'm sure our clients do as well. The other product that you typically use would be savings. And if you look at our savings, we do tick all the boxes and meet all the dots, where we do have reminders, we have training, we have specific targeted insurance savings products. But then if you look at the average number of our 2 million savings clients, only 5% of them have a balance of over $10. And then you think, well, $10 is perhaps enough for these clients, but then you wouldn't be able to cope with a significant or relevant shock. So I do think that when you ask our clients, for example, of the issues that they do face or the obstacles that they have when saving, the first issue would be lack of income, of course, but then the second two would be velocity, how quick we are in serving their or depositing the money that they need, or distance, for example, that our branches are too far away and they have to close a shop and their business to be able to actually reach our branch and to give them those funds. So I think that there is an opportunity there to think and redesign products and services, but also combine different elements and be more creative in how we serve our clients to improve financial health.
Of course, and I think as an impact investor, what I see here is an opportunity to align not only the impact goals, but also the financial goals between impact investor and microfinance institution. For example, we can use technical assistant to help to this type of microfinance institution to test some products, and because what we looking for is a long-term change. So for that, our financial interest and the financial goal can be aligned with the interests of microfinance institution. As you know, we use patient capital, so that means that we looking for the great impact. So this is the same that the microfinance institution is looking for
in the long term.
In the
long term, because that's one of the main issues we face. And I think that when we were discussing sort of product innovation and how you could support us, because this is quite challenging. One of the challenges that we face, for example, is lack of information of our clients. So we do know, for example, that age, level of education, or household size are relevant factors in how we segment our clients and actually tailor that need to that specific segment. But we do lack that information. I think digitalization would be a great tool to improve that. As we increase the digital trail, but also digitalization in terms of reducing costs of access for our clients to the services. And so we've been discussing, with you, but also with other people, sort of how can we leverage digitalization, that knowledge, to be able to improve and jump, make that leap of innovation to better tailor our clients for better financial health.
I totally agree with you. So in fact, I think that as impact investor, we can work with microfinance institutions, both to develop new products using maybe our knowledge and our global view. We invest in different technologies, in different products, in different regions. For example, I think that we have a lot of things to learn from fintech industry, and so maybe we can design together products and services in a more collaborative way.
No, I would like to make that call for action, because I do think that we talked about some obstacles in terms of distribution of those products and where digitalization could help. We talked about incentives. We do have a target goal for savings, but then they don't have the habit. But maybe if you set aside some money, because you have, it's easily to put some money aside when it's easily accessible from your phone, then you can change those habits and therefore change those incentives, because they do have the intention, but it's not that easy for them. But also the information that we have as financial providers and the, let's say, margin or room to maneuver to be able to do that innovation. So I think that when we think, going forward, and if you would have to summarize that in one statement, what would you recommend? Well,
I think that, our relationship between impact investor and microfinance institution could be more than a mere transaction. I think that could be a symbiosis. We can create and collaborate together to looking for the best for our client, designing products and services together.
I think we as a foundation, we are working on that. But I'd like to highlight maybe one thing. I think when we started in microfinance, we sort of recognized there's an opportunity to provide a product, a traditional financial product, to meet the unique needs of vulnerable segments. And I think that principle still stands. But I think that with digitalization, and as we learn more about financial health for these segments, there's an opportunity to be a bit more sophisticated and sort of work together collaboratively to find new tools and new solutions for our clients. So thank you very much for your time.
Thank you,
and
Stephanie.
we'll be in touch. Bye-bye.
Bye.